Hello everybody and welcome back to my channel. Today's video is going to be one that is actually pretty highly requested, all about the NICU. And while I can speak to the NICU a little bit because I do work in a facility where the NICU is part of our care team, I brought in another expert, a NICU translator, if you will, Mary from the NICU Translator, to come and chat with us today. Because even if you are not expecting for your baby to be in the NICU, about 10 to 15% of deliveries will require a little bit of NICU care. And this can range from just a few hours to a few days, weeks, months, depending on what's going on with your baby. So in today's video, we are going to chat all about what is a NICU, the different levels of NICU, what you might see if you're in a NICU, who you might see if you're in a NICU, and then ways that you can continue to connect with your baby, as well as some questions from you guys at the end. So definitely stick around and go check out Mary's Instagram and YouTube. I will have them linked down below. So Mary, thank you so much for taking time out of your busy schedule to do this video with me. If you wanted to introduce yourself a little bit and give your background about your NICU experience as a nurse.
Hi, everybody. My name is Mary, and I'm a NICU nurse in a level 4 NICU, which is the highest level acuity NICU. I've been a nurse for about 8 years, and I've only done NICU the whole time. I did a little stint in labor and delivery in nursing school, but NICU is where my heart is. I also am a nurse educator, which means that I focus on educating new NICU nurses and new NICU families about what life is like in the NICU. I have an Instagram and a YouTube account called the NICU Translator, where I answer lots of different questions and have lots of different educational material to help people feel more comfortable with the sometimes very confusing and mysterious language of the NICU. So I help to translate that for people. And I'm really happy to be here.
Perfect. And so Mary has her first YouTube video out. It is 10 things that your NICU nurse wants you to know. And I will leave it linked down below for you guys. I think it goes really well with this video and kind of goes over even more things about the NICU and things more specific to parents of babies who are in the NICU. We have a list of questions that we've kind of compiled just to give you the basic NICU rundown, and then some questions that we got from you guys on Instagram that we'll go over at the end. So Mary, could you tell us a little bit about what is a NICU?
So the NICU stands for Neonatal Intensive Care Unit, or sometimes it's called the Newborn Intensive Care Unit. And it's a special place in the hospital where there's a team of different healthcare professionals that are specially trained to take care of neonates, which are technically defined as babies that are less than 30 days old, but we see babies from day 0 all the way sometimes until closer to their first birthday. But we are specially trained to help babies transition from life inside of mom to life in the real world.
Sometimes that can be a tricky transition. I know when a lot of us think about the NICU, we think about premature infants, but what are all of the reasons why you might find your baby in the NICU?
So, as you mentioned, is a common misconception that all babies in the NICU are preemies or premature infants. But the reality is about 10 to 15% of all pregnancies in the United States, the baby will need some NICU care at delivery or a stay in the NICU for some period of time. So about half of the babies in the NICU are term infants. So there's a possibility that that might be part of your pregnancy and parenting journey. Some of the most common reasons are respiratory distress is a big one. Inside of mom, the placenta is doing all the oxygenating and essentially breathing for the baby. And when they come out, now they have to do everything by themselves. So for some babies, that's quite the transition. And they need a little bit of extra support and monitoring while they're kind of learning how to breathe, essentially. So having respiratory support and monitoring is the most common diagnoses for term baby in the NICU. There are also sometimes babies have a hard time regulating their blood sugar, so they are treated for hypoglycemia. Some babies have higher bilirubin or jaundice levels and need to be treated with phototherapy or other interventions. There's also, depending on how your delivery was or other risk factors, there is a higher risk for babies to have an infection. So babies really aren't born with much of an immune system. So we take any signs or symptoms of an infection very, very seriously, and they're often needed to be admitted and monitored for that. Sometimes also some moms might know prenatally that their baby is going to need NICU care and support. Those moms might be delivering in a special facility with the type of NICU care that they need. And then also preemies, that's it's 50% of why babies are here. But the truth is that about 80% of moms don't expect a NICU delivery. So for a lot of people, it's helpful just to have an idea that this is something that could happen. So it's a little less scary if it does.
Those are a lot of good reasons that make sense for babies to be in the NICU. You talked a little bit about how you work in a level 4 NICU, and
Mhm.
the facility where I work has a level 2 NICU. Can you go over the different levels of NICU care and what might influence you to choose where you deliver based on those levels?
Any place that you deliver that has a labor and delivery, those doctors and nurses are trained specially to help that baby with that first transition period. But the NICU is called in if there are needs beyond those first like few minutes of life in the transition. So a level 1 NICU is pretty much any labor and delivery. They have a special area that if a baby is having the need for more observation, they're able to go and have the intervention that they need. But if anything is needed beyond just that observation, then they'll be transferred to a higher level of care. So a level 2 NICU would be a facility that can take care of premature infants, but usually just about 34 weeks or higher, and only types of respiratory support that are more like oxygen and less flow and pressure. So that is a great place for, we call them like the feeder growers. So they just really need to learn how to grow and eat to transition. A level 3 is the next level up. And that I would say is vast majority of NICUs in the US are level 3. Those NICUs can take care of babies from the full spectrum all the way down to the super very tiny premature up to a term baby needing some respiratory support. But what a level 4 has that a level 3 does not is a level 4 NICU has in-house or in-hospital pediatric specialties. So if your baby needed surgery or needed to be seen by a pediatric cardiologist or other specialty, they would be transferred to a level 4 NICU. So what does this mean when you're deciding where to deliver? For most pregnancies, I say 10 to 15% need NICU care, but that means that the vast majority do not. So if you are healthy and don't have any risk factors, delivering in a facility with a level 2 or level 1 NICU is totally appropriate. If you have higher risk factors, or if it just makes you feel more comfortable knowing that there's a level 3 or level 4 NICU right down the hall from your delivery, then that would be a choice that you might have to make. Some families, depending on what their prenatal diagnoses are, may be encouraged to transfer and deliver in a facility that has a level 3 or level 4 NICU so the baby can get the support that they need right from the very beginning.
That makes a lot of sense. And I will say, from working at a facility that has a level 2 NICU, if we need more support, a special neonatal team actually comes and transfers the baby. And a lot of times, if we know that we're going to need the support before the baby's born, but the person who's giving birth is too far along in their labor to transfer them, then we'll even have that special neonatal team there for the delivery. So
Right.
we all work together to make sure that babies get the best level of care that they can get. Kind of going off of that and talking about that special little neonatal team that comes. We talked a lot about NICU nurses, and obviously there are doctors, but who else is a part of the NICU team in a big higher level NICU?
So the NICU is an interdisciplinary collaborative environment. So we're not just taking care of the medical needs of the baby, but we're taking care of the family as a whole and getting it so that the baby has what they need to transition and ultimately go home. So the NICU nurse is your first line, and they'll become your best friend if the NICU is part of your journey. They're with your baby for the whole duration of their shift, and they get to know them really, really closely, and you as well. So they're there to help support you take care of the baby as much as possible and to watch and communicate with the team for any changes or any other interventions that your baby might need. There's also specially trained doctors called neonatologists, and these are doctors that are trained in pediatrics and then decided to specialize further and receive more training specifically in neonatal care. We also sometimes have different facilities will have nurse practitioners, physician's assistants, or sometimes residents if it's a teaching facility, which are also important players in getting procedures done and being another set of eyes really to take care of the babies. As I said, also often babies reason for being in the NICU is having respiratory support. So we have specialized respiratory therapists that are there to manage all things breathing for the babies. We also have a team of support services like physical therapy, occupational therapy, speech therapy, child life specialists, registered dietitians, and pharmacists. And it might kind of sound funny to have a speech language pathologist work in the NICU because they're not talking yet, but in babies, it's all about kind of forming those developmental skills. So they work really closely with feeding. PT and OT work on state control and range of motion and being able to support the baby, especially premature babies, to be able to develop in a way that they would if they were still in the mom's tummy. So making sure that they have those supportive environments and services that they need to be able to grow and develop safely.
So it sounds like it takes a big team to help babies develop outside of the belly these skills that they would naturally develop inside. Can you talk a little bit about all of the extra things that might be on your baby, wires and leads and things that seem really intense and beeping machines? Because I know that that can be a really big fear for people who have their brand new perfect little baby in the NICU.
That's definitely for a lot of families the hardest thing is to see your baby as a patient in the NICU. But what looks like a lot of bells and whistles are ultimately pretty simple when they're explained. So every baby in the NICU will have leads placed on their chest, which are just stickers that are stuck to their chest and belly, and those are hooked up to a monitor that are telling the team what the baby's heart rate is and how fast they're breathing. They also will have a pulse oximeter, which in a mom might be a little clip that goes in their finger. On a baby, it's a sticker that we put typically on their foot, and that is telling us how much oxygen is in the baby's blood, which is really important when we're trying to see how much support they need with helping them to breathe. They also, in the beginning, will need some support with getting nutrition. A lot of babies that are premature or breathing too fast or unwell will need IV therapy support, so IV fluids to get their nutrition in the beginning. So they may have an IV in their hand or their foot, or some babies would put a special line in their belly button, which helps give us extra support and nutrition and maybe some specific medications that they might need. They also might have a feeding tube. So premature babies don't have the stamina or the skills to suck, swallow, and breathe. So they'll have a feeding tube that's either in their nose or their mouth and that goes down through their esophagus and sits right in their stomach. So the nurse will still be able to give small amounts of either breast milk or formula to help the GI system and the baby's gut just start to learn how to work. Because if it's a premature infant, it wasn't supposed to work quite yet. So we have to kind of turn it on with those tiny tube beads. And it looks kind of funny, but they really don't bother the babies. They're pretty resilient. They also might have some breathing support. So what that might look like in the NICU, they could have cannulas in their nose. They might be under a special oxygen hood. If they need additional support, they might have CPAP. So that would be, it's different in each NICU, but sometimes a mask over their nose or a bigger set of prongs that go in their nose. And if they're needing support beyond that, then sometimes they'll have a breathing tube. So that'll go from their mouth or their nose down their trachea and sit right above where their lungs are. And that can give them pressure and breath so that they are able to oxygenate properly. And then also a lot of babies need phototherapy. So they might have little glasses on their eyes and a blue light overhead, and that helps with neonatal bilirubin and jaundice levels. So it seems like a lot, but if your baby is in the NICU, it's really helpful to have a nurse just kind of walk through the equipment and point out what each thing does so you have a better idea of what you're looking at.
So, with all those things going on and everything that's going on in the NICU, and maybe a baby who is very, very small and premature or needing more and extra support, what are some things that I can do as their parent to help take care of them and feel like I have a role and a very important role, really, in helping to provide for my brand new baby?
So even though your baby may be in the NICU, you are still a new mama, you're still a new dad, you're still the family. And we want you to take the lead in caring for your baby as much as is safe and possible at that time. So we will work with you to do diaper changes, take the baby's temperature. We may be able to show you how to do a blood pressure, do a feeding, and kind of just learn those skills to help with the baby's cares. But ultimately, you are still that baby's rock and their emotional support system. So talking to your baby, they recognize your voice. We show you, if it's a premature infant, a special type of touch called a hand hug, which allows the baby to feel therapeutic touch. It helps them with growing. And we also support kangaroo care and skin to skin in neonates, especially preemies. And that can be even down to like the tiniest, less than 1 pound baby. So that time spent on mom's chest or dad's chest, we encourage skin to skin in both moms and dads. Really helps to stabilize the baby's blood pressure and help them to grow and start to bond and feel connected with their family. And then as they get a little bit bigger, they will work with you on feeding skills. So premature infants don't come knowing how to eat. We literally have to work with them to teach them how to eat food by breast or bottle. So we'll show you the special skills that it takes to help support a premature infant of how to feed. And ultimately, towards the end of your NICU journey, it's oftentimes the parents doing most of the care and the NICU nurse and supporting so we can get you safe and competent and confident to take your baby home.
So those were all the questions that we had prepared, but then we have some questions from some people on Instagram. So they had some questions such as like, how long do premature babies or preemies typically stay in the NICU? Is there a good rule of thumb for that?
Yeah, so it's kind of a tricky question because we always say never trust a preemie or never trust a NICU baby. We're just there to support them and they're on their own timeline. But the general rule of thumb that we tell parents is to expect your baby to stay in the NICU until their due date. So they're going to need the same amount of time to grow and develop in the NICU that they would in your belly. So if your baby was born at 34 weeks, you may expect term babies 40 weeks, a 6-week NICU stay. And that doesn't mean that they won't leave a little bit early or need some extra time beyond that, but that's just a general rule of thumb to kind of think about during those first few days in the NICU.
It sounds like in general, they need a similar amount of time to grow and develop with extra support, just like they would have extra support from your umbilical cord and your placenta in uterus. So another question we have is, how is pain control a priority for NICU patients?
So in the NICU, it is true that some of the things that we do to help support them and keep them safe are uncomfortable or painful. But we know it used to be the old school thought that babies don't feel pain, but we know that that just isn't true. And there's lots of different things that we can do to help support and keep your baby comfortable. Sometimes it's enough just to swaddle the baby, give them a pacifier, breastfeed while we're doing annoying or a noxious procedure. But for more challenging procedures, we sometimes use a little bit of sugar water on a pacifier, and that is shown to block the pain receptors in the baby's brain just for a couple minutes, 1 to 2, 3 minutes at a time to get them through that painful procedure. And if it is something that's longer or more complicated, there are specific pain medications that we can give to babies that are short acting and don't have long-term negative effects, but that can get them through those just uncomfortable parts of the NICU stay.
I love that you mentioned breastfeeding as a form of pain control. We do that with healthy term infants as well. Sucking can be a great form of pain relief for any sort of procedures and any tests that we do for a healthy term infant. But one question that I got time and time again is like, how can I breastfeed if my baby's in the NICU? What is breastfeeding going to look like? What kind of things can I do if I want to breastfeed and my baby ends up needing extra support from the NICU?
If breastfeeding is your goal, we want to support you to get there. And that can mean a lot of different things with a NICU baby. But the most important thing is if you're separated from your baby and they're unable to eat by mouth, whether because of prematurity or respiratory support, is starting pumping super soon after delivery. So normally in a labor and delivery setting, the baby would get that first feed within the first 30 minutes to an hour of life. So you need to start pumping that early on so you can start establishing that milk supply and being able to be ready when your baby is able to physiologically breastfeed and latch, that you have the milk supply to match with them. But in a premature infant, that can take a little bit of time also to learn the skill. The premature babies in the beginning are just taking tiny amounts of feed, usually by a tube. So don't stress about having a huge milk supply in the beginning. When a baby is learning how to actually breastfeed, the most important thing is skin to skin. And you can do that super early on before they're even able to really latch. So having that time on the mom's chest near the milk supply, being able to smell. Eventually, we kind of start to tilt the baby so they can start to lick and kind of nuzzle. And eventually, they may want to start latching and practicing. But the most important thing is to keep any type of oral breastfeeding experience super positive for premature or sick baby. It's less about milk transfer and growth and more about the experience. The more that babies practice and have these positive experiences, the more that they will be able to get stronger and latch and transfer and do all the things that a term baby would do at a breastfeeding experience level. But in the meantime, pumping is a huge part of NICU life. That is your feeding goal ultimately. If not, then we have lots of other ways to support and feed a baby as well.
Awesome. One of the team members that I don't think that you mentioned is a lactation consultant, and those are part of the NICU team. Sometimes it's the same lactation consultant that's helping in labor and delivery and postpartum as well that comes up and sees you. So you're not going to be totally on your own with the breastfeeding. But like Mary said, pumping is so important, and hands-on pumping is really important. I will leave you guys some videos and articles about that because that's a great way to maximize your milk output in those early days if baby isn't latching. This next question is about, I know someone who has a baby in the NICU. What can I do to support them? What are some things that maybe you should avoid saying if somebody has a baby in the NICU? It's a delicate topic and nobody wants to say anything that could hurt somebody's feelings. And how can we help support these parents?
It is. It's different for every NICU family what they want to have support. But I would say the general rule of thumb is that most NICU moms are happy and sad at the same time. So they're really, really excited and they're still a new mom. So they're all the things that you would say to a baby who wasn't in the NICU to that new mom, you can still say, your baby's beautiful. Congratulations. I'm so happy for you. But also being there and giving them space to be sad as well. So they're also going to be spending a lot of time in the NICU. So say like, hey, do you want me to run to the grocery store for you? Do you need help with your other children? Is there really anything that I can do to help you? And if you don't have the words to say, this must be hard, I'm here for you. And just giving them, knowing that the feeling that they're not alone is really, I think, the most important part for families, and to know that they have their village outside of the NICU walls that's there to support them.
Yeah, I think that village is so important for any postpartum family, but particularly when you have a more difficult situation of separation from your newborn, that village is really important, both while there's the separation, but then also when you're finally reunited with your baby and your baby gets to come home with you,
Yeah.
you're going to need support then as well. And that might be a time when perhaps both parents are back at work and trying to figure out what life looks like with a baby in the house for the first time. So just
Yeah.
offering support in any way that you can. And I know COVID sometimes makes this difficult. Okay, our last question is from somebody who is a new NICU nurse. And also we had some questions from people who wanted to be NICU nurses. If you could tell anything to a new NICU nurse, what would that be?
So I think that one of the most important things to remember as a NICU nurse is that you are supporting a family, and you are such an important part of the most exciting and scaring and vulnerable moment in a new family's life and a new baby's life. So just to be mindful of the little things that you can do. So the tiny wins that you can give families and empower them to take care of their baby independently, because that is the ultimate goal. We sometimes get stuck in NICU nurses and in the confidence that we have in our skills and kind of being able to do those tasks. But the most important part of our job is to make sure that the family can do the tasks and be able to care for their baby, no matter what that means.
I love that answer. Yeah. Sometimes as a nurse, you get so fixated on the nursing part, you forget about you have a whole patient. And in your case, you have a whole patient and then the whole family that's there
Family.
to be a part of support for that patient. Thank you so much for taking the time out of your day to do this interview and recording with me. If you guys want to check out Mary at the NICU Translator, I will have her Instagram and her YouTube video link down below.
Any other questions, head on over. I'm happy to answer any questions that you might have. And thank you so much for having me. This was so much fun.
I hope that that video was as helpful for you guys as it was for me. Mary is such a sweet and caring person, as you can really see from her videos. And if you guys have any further questions for me or for her, or would like to share your NICU experience, please leave them in the comments down below. Bye guys.